where the recording starts. Wait 5 seconds and then you can start, okay?
Very good. Okay.
Okay, go ahead, Mr. Nolan.
My name is Robert Nolan, and I'm Chair of the Community Relations Committee of Health and Hospitals. I hereby call to order the meeting of the Community Relations Committee of the Board of Directors of the New York City Health and Hospitals for Tuesday, January 12th, 2021. I now call a motion to adopt the minutes of November 10th, 2020 meeting. I'd like to poll the members who are here so that we can move towards that adoption. Dr. John?
Yes.
Dr. Katz?
Yes.
Anita Quatra? Okay. Kalisha, can I adopt these minutes with the yeses?
Yes, we do have quorum, yes.
I thought so.
Mr.
Okay. Based on the yeses that we all heard, the motion is adopted and the minutes are adopted from the November 10th meeting. We have scheduled today for this this meeting, several of our cabs across the city. As you may have heard from Kalisha, we know that Health and Hospitals Carter is here and that Kings is here also in Bellevue. So we will be waiting for East New York, Queens, and Woodhull. But I will proceed with my own statement and then we'll move on to the reports from the various cabs. Before I start, I hope that everybody is well. I know this is as bad a time as it's ever been in our city. I know that not only is the Health and Hospitals operation moving as quickly and as quickly as they will hear from Dr. Katz on that, but I know that it's very, very difficult for all of you at the local level, heading cabs and representing your cabs. And I know you're working very, very hard and very diligently. And on behalf of Health and Hospitals, I thank each and every one of you for that. I'd like to wish all of you a Happy New Year. With the advent of the long-awaited COVID-19 vaccines, the year 2021 appears to be the light at the end of the tunnel we've all been waiting for. As we look ahead with hope and Thanksgiving, I also want to take some time to reflect on the great work that NYC Health and Hospitals continues to deliver on behalf of its patients. To honor our staff of more than 40,000 healthcare workers who saved countless lives during the pandemic, Health and Hospitals has launched a COVID-19 Heroes website that will serve as a digital archive of the health system's response and preserve the legacy for future generations. We also opened the first of 3 COVID-19 Centers for Excellence in the Bronx, with the remaining 2 to be opened in Queens and Brooklyn in the coming months. And lastly, we launched the 3-2-1 integrated model for parents and children together, referred to as IMPACT program, which aims to support the health and well-being of our young children and their families by integrating 3 disciplines: mental health, pediatrics, and women's health. I would also like to congratulate the test and tracing team. To date, over 1 million COVID-19 tests have been performed. Additionally, 3 out of 4 people reached by contact tracers completed the intake process, up from only a half in the first few weeks of June, which is just absolutely fantastic, when the program launched. And 64% of the people who completed the intake process are sharing contact information, up from 35% in June. Notably, 18% reported that they did not have any contacts to share because they have not had any recent meaningful in-person interactions. While 2020 was a year like no other in recent memory, the Health and Hospitals team showed remarkable fortitude. On behalf of the New York City Health and Hospitals Board of Directors Community Relations Committee, I would like to thank the entire team for their commitment and dedication to our patients. And now I'm going to turn the meeting over to Dr. Katz for his remarks. And before that, I want to thank Dr. Katz for all that he has done. I watch the mayor's briefing almost every morning, and several times a week, Dr. Katz is there responding directly to the questions that come from the press. And I want Dr. Katz to know how proud I am of him for doing the outstanding work that he's doing right in the eye of the tiger as we battle this terrible COVID virus, which has taken the lives of so many New Yorkers and our fellow citizens in the country. I will at this point now turn to Dr. Katz for his presentation.
Thanks, Robert, and thanks to you and to the members of the community advisory boards. It is a very tough time right at the moment. In terms of the second wave resurgence, we're up to about 450 patients in the hospitals, in the 11 hospitals now, little over 100 of whom are in the ICU. The positive thing compared to our first wave is that the mortality rate is much lower. Most people are getting discharged or getting better. We're not having the high mortality that we had in the first time. Also, we have enough PPE. There's no struggle around having to scrounge around for sufficient equipment. We have enough N95 masks. We have enough gowns and gloves. So that's no longer an issue, and ventilators are no longer an issue. What makes this surge harder than the first round is that we haven't seen the drop off of non-COVID patients. That's a good thing in many ways because people lost their lives by not coming forward in round one when they were having chest pain or shortness of breath or serious symptoms. People were so frightened of going to any hospital that they stayed home no matter what was going on. That wasn't good, but it did make it easier for us to deal with almost 4,000 COVID patients we had. This time around, the non-COVID census remains the same. So the additional 450 patients causes us a strain. We are already canceling elective surgeries, and we are going to more virtual visits in the outpatient arena to bring nurses into the inpatient areas to deal with it. We're getting as many registry staff as we can, and at least so far we are holding our own. But we know we have to do this alone. We're not going to have the 9,000 additional providers that we had in March and April. So it has to be us. Meanwhile, Health and Hospitals is now the largest part of the city's vaccination efforts. We're vaccinating at all 11 hospitals, at all our federally qualified health centers, and then we're also opening up several additional sites like the Bathgate site that I was at in the Bronx on Sunday. So for vaccinations, people can go onto the city's website, which is www.nyc.gov, and then it's /vaccine finder. If you go to that site, you can then choose a clinic that is near you. The website has parallel health and hospital sites and Department of Health and Mental Health sites. Depending on which one you choose, if you choose a health and hospital site, you'll come to us. And if you try to register for vaccine, you'll find that right now we've filled all the appointments in general for the next 14 days. We release every day new appointments for that 15th day. So tomorrow there'll be appointments for Wednesday, 2 weeks from tomorrow. However, all through the day, we release appointments if people cancel. So there is some ability. Sometimes you'll hear from someone, I just was able to get an appointment in 2 days, and someone else will say, well, that's impossible. I was on the website 2 days ago and there were no appointments available. But in order to maximize the number of appointments, the way the website is created, the second someone cancels an appointment, one appointment appears. So if you're the lucky person who logs on during that time, you'll get an appointment. If you choose a DOH MH site, then you'll get to their website. I think they are booking 3 weeks in advance, and I think there still are some appointments going out 3 weeks at their various sites. Mayor announced today that we're going to do another site at Citi Field, which would be a massive site. We are all hopeful that the vaccine supply holds. It's conceivable that we will run out of vaccine before we get more vaccine, but as we're clear at saying, vaccine, we want it in people's arms, not in the freezer. Better to get it in sooner than later. And how better can we demonstrate why the feds should send more vaccine to New York City than to use it all? So we're not afraid about the possibility that we may, in fact, use it all and then have to put a hold on appointments until we get more vaccine. And then finally, on the our T2, our test and trace, we passed the 100,000 tests mark last week. And more of the tests are rapid tests and people are coming forward. So in closing, I just want to tell you a real life story about today. We're very focused on COVID. We're all clear that what could be more important than vaccinating everyone. This is the way that we can prevent future cases, keep people alive, prevent the horrors of March and April. One of my CEOs from where you live, Bob Jacoby, called me today and said, Mitch, I'm sorry I can't be on the cabinet call at noon because there's a multi-casualty trauma and we have 3 patients already in the emergency room and 3 additional on the way. And so just to point out that while we are dealing with the COVID surge, dealing with 100,000 COVID tests a day, becoming the largest supplier of vaccine to the public at large, rewriting the website every time the governor expands access, we are also, first and foremost, a trauma center, a hospital system, a clinic system that still has to be here to take care of people's other problems. So with that, I look forward to hearing the reports. I may have to step out for a vaccine update. People will forgive me. I'll come back if I can, if the meeting is still going. So thank you, Bob.
Mr. Nolan, you're on mute.
Okay, I'm on. You can hear me now?
Yes, we can. Thank you.
Dr. Katz, can you give us 30 seconds on the Center for Excellence that's opened up in the Tremont Center of the Bronx, one of 3? And what's special about that particular facility that compared to other facilities that we have?
Well, thanks, Bob. So what's special about that facility is it's really aimed to take care of people who previously had COVID. So we know that there are large numbers of people who've had COVID and have remaining respiratory, cardiac, psychological impacts from the COVID. And that clinic was built especially with the kind of radiologic and pulmonary function testing that we would need in order to take care of people who's previously had COVID. It also is a center for doing COVID tests, and we hope will soon be a center for being able to do vaccination.
Okay, thank you very much. I really appreciate that. I'm going to move on. Before I do that, I want to announce that Anita Quatra, one of our board members, has joined the meeting. Welcome, Anita. I'm now going to move into the formal part of our agenda where we have 6 facilities presenting their verbal annual report. Today's reports are brief but focused because we are exploring ways to make the report even more meaningful to the CABS and to the Community Relations Committee. And if you have any ideas, once again, please let me know. Each presentation is allowed, as usual, 5 minutes, and we are grateful for the work that went into preparing them. Thank you in advance to all of our speakers for their time and commitment to the system. I'm going to start off with our first scheduled speaker from East New York, Ms. Vera Gibbs. Ms. Gibbs, can you hear me?
Gibbs, you're on mute.
Ms. Gibbs from East New York, can you hear me?
Yes, I can hear you, but apparently you can't hear me.
No, I can hear you.
You can? Oh, okay, thanks. Because I'm not real au fait with this. Good afternoon, everyone. Mr. Nolan, Dr. Katz. This is Ver Gibbs, Chair of the Community Advisory Board at East New York, Gotham. Our report indicates that in reference to the COVID-19, Gotham Health East New York has tested over 26,000 patients since the beginning of the pandemic. This number reflects both the testing location and the mobile testing van. Clinical teams provided patients with most updated information about the pandemic and educated them on the importance of getting tested. Physical plant and equipment. We continue to upgrade equipment as necessary to ensure that staff is equipped to perform their jobs effectively and efficiently. Modernization of both elevators continues. Installed flat panel LED lights on the second and third floors and part of the first floor. We partnered with Graffiti Free NYC EDC to remove graffiti from the building. We installed departments' signs, e-well, HB, etc. throughout the building so departments can be clearly identified from the common hallways. We installed temporary sneeze guards throughout the building to protect both staff and patients. The most frequent complaints was for patients not being able to get through to the call center. Compliments. During COVID-19, patients expressed their satisfaction with the care provided by East New York Gotham. Community issues remain the high rate of diabetes in the East New York community. Our community outreach, Community Affairs has distributed over 7,000 flyers to residents, NYCHA, small businesses, and community partners on the importance of getting COVID-19 testing done. Community, I'm sorry, give me a moment here. Just a second.
Take your time.
Okay. Okay, the Community Advisory Board partnered with Community Board 5 and Gotham Health, East New York, for cleanup of the Grace Playground. We thank Dr. David John, the CMO of Gotham Health, for his effective and continued leadership at East New York Gotham. We thank Ms. Michelle Lewis, CEO of Gotham Health, for her continued support of East New York Gotham. We thank the entire staff, especially Community Affairs and East New York Gotham leadership, for their input in making 2020 a successful year despite COVID-19. Thank you.
Thank you so much, Ms. Gibbs, for that report. Can you tell me that since the report was written, has there been an improvement with calls into the call center? And that could be answered by you, or perhaps if Ms. Lewis is on, or her representative, perhaps they would have it.
Well, I understand the leadership is working on it. As far as specifically what might have been done, the leadership will have to tell you. I don't know if Ms. Lewis is there or Ms. Jones.
Okay, then we will follow up with her. Do the board
Okay.
have any other questions for Ms. Gibbs? Hearing none, I want to thank you, Ms. Gibbs, for joining us. I hope you can continue to be part of the meeting as you go through the other calves that will report.
Yeah, I will for as long as I can. Thank you.
Thank you so much. I now want to introduce Ms. LaShawn Henry from the Carter Center and ask Ms. Henry to present her report. Ms. Henry, can you hear me?
Yes. Can everybody hear me now?
I can hear you, so please welcome and please
Wonderful.
begin the report.
Yes. Good evening and Happy New Year to Chairperson Nolan, Dr. Katz, the Health and Hospital Board, and my fellow CAB chairs and members. My name is LaShawn Henry, and I am the CAB chair for Henry J. Carter. I will be submitting my report for information purposes only. However, I would be remiss if I didn't highlight the amazing work under the leadership of our CEO, Mr. Floyd Long, and his dedicated staff. in caring for the COVID-19 patients and prevented COVID-19 outbreaks by taking all the necessary steps to get tested twice a week. They also had to go through temperature checks daily and quarantine when necessary. This not only protected the patients at Henry J. Carter, but it also protected the staff and their families. We all know that COVID-19 is not only a debilitating, deadly disease, but it further contributes and exacerbates loneliness and isolation from family and friends. Henry J. Carter invested a lot of goodwill, manpower to keep family and loved ones connected. To reduce the impact of these issues, Carter implemented a number of initiatives to adhere to COVID protocols. They had iPads donated by the wheelchair charities, and they were used to provide virtual calls between patients and residents with their families. The virtual calls helped mitigate the feelings of loneliness. They also had interpretation cards that assisted with communication. There were over 3,000 FaceTime calls and Zoom meetings. There have been town halls to update the community and families on COVID-19. There is also a Henry J. Carter hotline number to update families who have loved ones in the Henry J. Carter Hospital facility. I just want to commend Henry J. Carter, Dr. Katz, Health and Hospital for the tremendous work that they have done and continue to do as we continue to battle this disease. I would like to also take a moment of silence for the 379,000 souls that have been lost to this disease. Thank you.
Thank you so much, Ms. Henry. It is a truly difficult time for all of us, and we get through it one day at a time, and I appreciate your presentation. I want to congratulate the Carter team on completing over 2,800 calls, and at the same time being able to get those iPads that enable you to do that.
Yeah.
Are the families satisfied that they're able to communicate with the residents at Carter?
Well, I mean, they're not totally satisfied because everybody wants to touch and feel their loved ones. But in the meantime, this is something that, you know, has to be done to make sure that we continue to protect everyone.
I see. Are there any other questions from any of our committee members or board chair, Jose Pagan or Dr. Katz or Anita Quatra?
Just kudos to the team at Carter for keeping the communication going. Thank you, Bob.
Thank you so much, Doctor. Seeing that, I want to thank Ms. Henry for the presentation of her report, and I hope that you can continue to be on our meeting as we continue to go through the other hospitals. And thank you so much again for your presentation and for your continued support of everything that we all do together.
Thank you so much.
I'm now going to recognize Dr. Anthony Andrews of Queens Medical Center. Dr. Andrews, can you hear me?
Hear you. I can hear you. Thank you, Chairman Nolan. I appreciate it.
Thank you so much. It's good to hear your voice.
Good to hear your voice also. I'll be very brief. So in our report, because we submitted our report already, I'll just very brief. Of course, the numbers are going up, COVID-19 in Queens. We knew this, we expected it, we've been preparing for it. We've been making sure that, of course, we have the equipment necessary to be able to address this issue and making sure that the nurses have the education that maybe they didn't have before in our first phase with this COVID disease. So to make sure that they're very prepared to assist us with the things that the doctors are doing on each one of the COVID-19 floors. Infrastructure and equipment, of course, we've upgraded. We've got a new CT scan so we can do the scans properly. Patient satisfaction, you know, we've obviously had some complaints about, and I think during this time, there's a lot of stress, a lot of pressure, particularly in our hospitals in Queens. Patient satisfaction has been challenging. Making sure that we have the patient's issues and needs addressed properly is of primary importance, of course. It's been customer service for the most part. We've been addressing the customer service with the iCare model. and also dealing with issues, complaints, and challenges that have come up with individual patients to make sure that they're addressed very promptly. You know, obviously we have a lot of comorbidities in our communities of color, in particular in Queens, which we have primarily with our catchment area. The numbers have gone up, and we tried to address that with not only the televisits, and we lead the system in televisits now. So we're doing a great job with the televisit model, but we're also trying to do this, pioneering a new combination of televisits and in-person diagnostic visits so that we could be able to address the concerns of the community in a little bit different way, a slightly different way than we have been doing in the past, and not just with televisits also. So this has been working well, and we continue to work with this combination of televisit and in-person diagnostic visits, and trying to address the COVID-19 crisis in our borough, and particularly in our catchment area, which includes Southeast Queens, where we have 5 of the highest percentage positive rates in the entire city right now. So that's my report, Mr. Chairman.
Thank you very much, Dr. Andrews. It's good to see you again. You mentioned in the report your concern about resources diverted as a result of COVID. Can you give any specific examples which you believe are very a concern to the hospital at this time, that these resources should be diverted?
No, not resources diverted, Ken and Nolan. We're concerned about making sure that we have the resources, and of course, we have the resources. We've made sure that we've installed plexiglass where needed. We've made sure that we have the equipment that we've needed, the PPE. So we're not necessarily concerned about resources being diverted. We have everything we need right now to be able to satisfactorily address the situation. If at some point that becomes an issue, then of course we'll bring this back to the table. But at this point, not concerned about resources being diverted. We have the resources necessary to be able to address the situation in our community.
Okay, and how the television's working out? Because I know that doctors can just accomplish so much with a televisit, but from what you've been hearing, how well have those televisits been working out at Queens?
So far, so good. We've been able to address a number of situations with televisits. The doctors are becoming more proficient in the use of televisits, and we've been able to address a lot more patients and a lot more constituents who have come to us and said, I need assistance, but I can't get into the hospital. So it's been working out very well so far.
I think it's terrific. Absolutely, absolutely. Because you don't always need to make that visit to the hospital. Sometimes you need to have doctors answer questions, and if they can, then that's a terrific new way of us bringing our patients together with our doctors in a more convenient way. I'll now ask the other members of the committee whether they have any questions for Dr. Andrews.
I would just add for what Tony has said, that as a practitioner, the phone visits work pretty well. I mean, there are some things that are somewhat challenging, but I've had patients now, they text me pictures of rashes. I send orders for blood glucose testing kits, blood pressure kits to their pharmacy, or they pick them up at Gouverneur. So we're learning how, for even the things that you might say, well, on the phone, how can I know what someone's blood pressure is? Well, I can order a blood pressure kit for them, and we will provide that free to uninsured patients at all our centers. They can then find out their blood pressure, and it's not only equally to the visit, it's actually probably better, because your blood pressure when you're home is probably more important than your blood pressure on a single office visit. So I totally agree with Tony that it's an important part. Not as good for first visits. I think that there is value in two people meeting each other in person the first time, if at all possible. But follow-up visits, I think, work exceedingly well.
And I would think, doctor, that for yourself and for other doctors, you can accomplish a lot more with televisits, because you can see so many more patients. You'll see them and you can televisit other persons, and you'll probably, during the course of a couple of hours or a day, see so many more patients than you would before televisits, correct?
Right, and it's also very thoughtful for the person, remembering that many of our patients, and I know many of mine, come on public transport with two
Yes.
small children. Right.
Yes.
So, that's never easy. So if I can address their issue by phone, people are much more accepting.
Thank you very much. Are there any other questions at all that want to be raised by our committee members? Hearing none, I want to thank you so much, Tony, Dr. Andrews, for your presentation and your participation. And I will look forward to speaking to you soon.
Thank you, Chairman Nolan.
I'm going to move on then to Woodhull Hospital. Is Miss Julissa Herrera on the phone?
Hello, and thank you so much, Mr. Nolan. I appreciate it.
Okay.
I wanted to first start our CAB report by saying thank you to all of you for your collaborative work and continuing during these most challenging times, and the amazing teamwork of the medical and administrative staff at Woodhull Hospital. Thank you once again for helping us start this new year as best as possible, and we're moving forward and pushing forward. So with Woodhull, we have been and continued actually preparing for the second surge of COVID-19. It was a process that the not having much time to take a break, still juggling through so many things that have been going on. The hospital did prepare and begin preparing for the second surge of COVID-19. And in the areas such as space, several inpatient medical surgical units that were activated for the first surge are still available. So for as far as 70 beds being added based on the governor's order to increase bed capacity by 25%. In emergency, because of the major renovations being undertaken in the emergency room, some of the surge spaces used in the first surge are not available. But the ER operations have been extended to the express care area, and everything is working well, which is a great thing because the express care actually was, open just last year, and it is very handy right now. Ambulatory clinics are running at regular operation at about 90% visits are in person and 10% are televisit. As the surge has increased, the clinics will be considered to be closed. Staff will be redeployed to inpatient and emergency areas. Surgery. Elective surgeries have been canceled and urgent emergent surgeries only are being done. Operating room staff and space will be redeployed to inpatient ER as needed. In the area of behavioral health, volume and activities are less than the pre-COVID levels, but relatively stable. Staffing is adequate at this time because our census and workload are about 60% pre-COVID level. Nursing staff has been cross-trained to be able to function in different areas of the hospital in order to handle the expecting surge. If sufficient, new external nurses are not available to supplement our staff. Supplies are adequate and PPE is stocked and available to ensure the safety, which is a great thing this time around to be able to know that we do have adequate PPE and we're stocked. COVID patients. Consistent with the surge, the number of COVID positive patients is increasing, but not overwhelming at this time. We are coordinating, of course, with health and hospital to transfer patients in and out of Woodhull to ensure the volume is manageable. In the area of the physical plant itself and equipment, we continue to upgrade the equipment as necessary to ensure that the staff is equipped to perform their job effectively and efficiently, such as renovations. Several major renovation projects are in progress. Emergency room renovation expansion is on the budget and on time, with completion scheduled for February 2021. Upgrade of the elevators, number 7, 8, and 9, is on schedule to be completed by June 2021. Kitchen upgrade of food warming system facilities to D-Next is on schedule to be completed by January 2021. The outside facade repair project is funded bidded and contractors are being selected. Oxygen storage tanks upgrade is complete. And in the areas, of course, of complaints, we have heard complaints such as patients regarding wait time. We've had issues with staff attitude and property loss, and community issues. There has been expressed some specialty services are not available at Woodhull. So patients are referred to Bellevue and other hospitals, which does cause inconveniences. The recruitment is ongoing. At the time, we all know that there is a shortage of staff, and it is being worked on. Overall, the hospital is able to and open to continue helping and assisting and serving the community as best as they can. Thank you so much. I appreciate the opportunity.
Thank you so much, Ferreira. Is there anybody on the call from the capital unit within Health and Hospitals who can provide an update for Ms. Herrera and everybody else at Woodhull on the several capital projects that are listed there in their report?
We can make sure we get
We
some
may have
follow.
to get, yeah, we'll get some follow-up.
Okay, because we had talked about that, and if we can get follow-up, two of these projects state here that, in fact, one of them says it's going to be open up the kitchen upgrade as of this month, and the other one at the very, very beginning, the emergency room renovation expansion is scheduled for next month, which is perhaps 15 days away. So, Ms. Herrera, we will get you an update on those projects, and we'll get that in your hands so that you know that. And that Mr. Calista, Greg Calista, your CEO, also is aware of that. I'm sure, because I know Greg from his days in the Bronx, he's on top of that already. But I just want to make sure that everybody is. So we will get that information to you when we have it.
Wonderful. Thank you so much. I appreciate it, Mr. Nolan. Thank you.
Are there any questions for Ms. Herrera from the board members who are on the on the committee meeting?
Yeah, hi. I just wanted to know whether, whether transportation is provided to patients that are referred to Bellevue.
And
Yes.
Yes. It is.
Okay, thanks.
Okay, any other questions? Mr. Herrera, thank you so much again. We look forward to seeing you soon, and we appreciate your report.
Thank you.
I'm going to move on to Kings County Hospital. Mr. Warren Burke, is Mr. Burke on the call?
Yes, I am. Happy New Year to everybody.
Happy New Year, Warren.
Thank you very much. I was looking at giving this report, and there's a lot of nuts and bolts in the report. If I was to list what's going on at Kings County Hospital, it would take me 2 hours, because I have never seen so many projects being implemented at a time and implemented successfully, whether it's hot zones, cold zones, testing, vaccines, ambulatory care, going from phase 1 to phase 4 is just amazing to me. And what that really brought to mind were the people behind it, probably our greatest resource that really is not included in the report. I'm assuming the board knows most of the things that are going on at Kings County Hospital. So I just want to highlight the leadership of the hospital. And they're just an example to me of people who are dynamic and transparent. I have very rarely seen so much flexibility in any organization that I've been involved with. And there is really an esprit de corps that makes these operations successful. So with Mr. McLeod, Graham Goulian, Nurse Chung, and Dr. Pasteur, they just set the tone for everything that has to be done, and we're very thankful for it. Another thing that I think that is significant and may have brought positiveness in a hard time is that our CAB has really developed a coalition of organizations with Kings County Hospital as the background, and we are working very steadily to provide services to our residents We are working hand in hand with our elected officials, our community boards, and many stakeholder groups, whether it's distributing food, PPE, and information, or helping people get appointments at Kings County Hospital. So I'm pretty impressed by that, and I just want to give a shout out to Carmen Martinez and Francesca Leopold, who really led that effort. In terms of infrastructure and equipment, I'm just really amazed at the technology upgrades that health and hospitals have been given each hospital to use, and it has made such a difference in our community. We always had an image problem, and we always had a lack of marketing, and I believe that at the present time, through Kings County Hospital's good work with testing and now the vaccines, we are getting some very, very good press from our local technology channels. In addition to that, by using social media, as well as working with all of our stakeholders to get the word out, I think that the reach of Kings County has really increased. In terms of patient safety, as far as the study goes and statistics go, is up. I can't comment too much on that because, being a manager, it really, any organization is going to have some percentage. So if you have 5,000 patients and you get 1%, it's a decent amount of people. The one thing I will say is that based on the reports we get, that everything is investigated, everybody is answered, and it seems to be that the percentile scores of, the HCA, HPS are going up. So I think that's pretty impressive, especially in a time where everybody is under the gun. In terms of frequent complaints raised by patients, the biggest thing is, you talk about technology and televisions, that a lot of people in our catchment area do not have broadband. And we need to find a way to put this tool in their hands by either working with the government or someone to get broadband packages for these people so they can utilize it. One figure I'll throw out is that at the present time, 25% of the visits to Kings are tel, and 75% are in person. So that could be one indication. A lot of our community members face barriers just to receiving services, whether they're immigrants, low socioeconomic, or just afraid to go out, or senior citizens. One good news is that where pharmacy was a major complaint, the compliments and the service that we're hearing has improved significantly. That's my report. I want to thank you all.
Well, Mr. Burke, I want to thank you for an extremely comprehensive report and also your ability to break down your extensive report into highlights. And I appreciate hearing about, as well as members of the committee, the good work being done down there by Sheldon McLeod and his team that really makes all of this possible for Kings County. I wanted to ask you a question about the types of services that there were complaints being made about, where community members face barriers to receiving services in areas of professional and administrative customer service. Can you give me an example of the areas that fall into professional and administrative customer service where the community folks feel that we could be doing more?
Yes. The first thing is that in terms of one of the major barriers is, number one, getting to the hospital. The second major barrier is really, customer service in terms of people not being treated properly. And I think that this creates a fear and may turn people off. And it could be the same thing with the professional services. My opinion is that it's a minority, but in the age of immigrants having access problems and the lowest socioeconomic groups, that's in our catchment area, I think it's a very difficult situation for people to come.
I understand, and thank you for that response. Are there other questions, Mr. Burke, from other committee members? Hearing none, I want to thank you, Warren, and thank you for
Thank
again
you.
comprehensive report and look forward to further conversations with you in the not too distant future. And give our best to everybody down there at King's. And finally, making her comeback back on the board as the chair of the board, Louise Dankberg will be presenting on behalf of Bellevue. Louise, as I had a chance to chat with you earlier, welcome back to the board. We've missed you. Louise Dankberg, can you hear me?
Louise, I see you're still muted.
Okay, now can you hear me?
Is that you, Louise?
Yes, I
Hi,
am.
it's Bob Nolan. Welcome back. I said earlier that we're pleased to have you back as chair at Bellevue, and we look forward to your report this evening.
Thank you so much. It's wonderful to be back. And it was wonderful hearing the reports prior to mine. It's so heartwarming to know that we are all part of this wonderful health and hospital system and doing so much good for so many people. As Mr. Nolan said, I am back. I am the chairperson after my 1-year hiatus. This past year was not a very good year for me. I had developed severe COVID myself and was treated at Bellevue Hospital. And it is the staff at Bellevue Hospital that kept me alive and made me as good as I am today. And I'm going to say that again. The staff and everyone at Bellevue Hospital saved my life. And I can't tell you how important that is to me. Uh,
To all of us, Louise.
Thank you. And now that I'm back, I wanted to be able to say thank you by giving back to Bellevue and being active again. Our CEO, William Hicks, has kept the CAB informed of how Bellevue is combating COVID on an ongoing basis. And we in the CAB were very fortunate. Only 2 of us contracted COVID and we both survived. I also congratulate Mr. Hicks, who was named number 41 in the City and State Power 50. We are so proud of him and are so pleased to be part of his team. I also encourage all elected officials to attend our meetings and speak on public health, both in their districts and citywide. I'm very involved in the community and other in Bellevue. Pleasure of knowing many of the elected officials personally. I urge them to come to meetings to let us hear their voices, even if they can't vote. And if you know of anybody who wants to be notified of Bellevue meetings, please give me or let us know their email addresses. Now to the executive summary. COVID-19. We have opened 3 ongoing facilities with an additional 38 beds, ICU capacity, and negative pressure rooms. Nursing has been managing the coverage of the additional beds. Bellevue performed more than 55,000 COVID tests, and the turnaround time for these tests is less than 48 hours. We have successfully treated and discharged over 1,765 COVID patients, including me, and continue to prepare and improve our strategies in preparation for a probable additional wave. We have vaccinated the emergency room staff, ICU staff, and patient care departments, and are now going on to employees and volunteers who are eligible for the vaccine. Infrastructure. Plans are underway for a full renovation of the Adult Comprehensive Psychiatric Emergency Program, which is located on the ground floor in the main hospital building. To make room for this, construction has been completed in Section 18 East to serve as an interim home. Attached to the report is a sample thank you letter from a satisfied patient. We receive many such letters, and it is very moving to know that we are doing so much, so well for so many. We've had significant gains in our patient satisfaction scores despite the pandemic. We've recently achieved the 48th percentile for patient satisfaction and rate the hospital in the 52nd percentile for the hospital metrics. We have an ongoing relationship with the Bellevue Auxiliary and they have partnered with Key Foods to offer gift cards to all discharged patients who have food insecurities and are in need of proper food intake. And together we do whatever we can to help each other. I have an ongoing relationship with the chair of the auxiliary, Wilbur Weeder, and so we talk about a lot of things where we can participate together. And I thank you for giving me the time to present what Bellevue is up to these days. And I look forward to being with you for a very long time to come. Thank you.
Yeah, thank you very much. And we certainly appreciate the fact that you're back. I did not know that you had been suffering from the COVID virus, but I'm so pleased to hear that you've recovered, and we'll keep you in my prayers from here on. And I do not have any particular questions of Bellevue, but I ask the board members if they have questions to please ask those questions now.
I would just say that it's always wonderful to hear stories like yours about people who get their care with us. I won't reveal any confidentiality, but a doctor in our system wound up at a different system getting care, very unhappy, not doing well, came to our system, to their home hospital, and turned the corner. And I believe that it was some combination of getting the right medical care and knowing that you were in a place where you were loved. Because I'm a big believer that knowing that you are being cared for, makes people strive to get better. That not every part of medical care can be broken down into science and, ventilator settings. That I've seen how when patients really want to survive, how much that helps, and when their providers are really working with that strength. So it makes me happy to know that you wanted to get your care at Bellevue and that Bellevue took care of you. That really makes me feel great.
Thank you. And you made me feel great. Again, thank you so much, Dr. Katz and everyone.
So thanks again, Ms. Dankberg. Thank you for presenting your report. As I look at the agenda, I will now ask, is there any old business that anybody wants to bring up? Is there any new business? Before I adjourn the meeting, I want to make two announcements. One, our public hearings for the year 2021 will be coming up in a couple of months. I believe one is scheduled in March and a couple in April. You'll be notified the actual dates and the locations. That's not available yet. But as you know from other meetings that I've chaired, I consider attendance by the cabs at the public hearings to be essential. It's as important as your meetings with your CEOs and your presentation today. It's important that you take out the 5 minutes and you tell us what's going on at your hospital, in addition to what you've told us today. And you might make some of those comments that are very similar to what you've made today at the public hearing. But please take advantage of that. I like to see full attendance from, oh, there's everybody. Okay. I like to see full attendance from everybody at the public hearings. And finally, our next scheduled meeting of this committee is March the 2nd. It'll be at 5 o'clock, and you'll be notified if there's any change to that by the central office. Hearing no other.
Mr. Nolan, I'm sorry, this is Felicia. Mr. Burke, I see your hand is raised. Do you have a question?
Nope, I must have pushed the wrong button.
Oh, okay.
Okay, thank
Not a
you.
problem. Are there any
Thank
other
you for asking.
can see that perhaps would like to ask a question before I close the meeting? Seeing none without my glasses, and sometimes with, I think I see better without. Hearing none, I'll call a motion to adjourn this meeting. Is there a motion to adjourn the meeting?
So moved.
So moved.
So moved. Okay, the meeting is adjourned. Thank you for your support. Stay well. Keep everybody in their prayers. Take care. Love you all.
Thank you.
Thank you.
Thank you, Bob.
For those joining the Council of Cabs meeting, please log on to the second link. Thank you all so much.